Good afternoon. Thank you for joining us. Vancouver Mayor Ken Sim has spoken to CBC News following yesterday's stabbing in downtown Vancouver. We'll hear that up first. On the open line, we talk about food insecurity, and we're asking, what impact do high food prices have on public health? How do you manage a healthy diet with high food costs around you? Plus, we are making the season kind ahead of tomorrow's food bank fundraiser at CBC. In half an hour, call in and tell us, when has someone been kind to you? We'd love to hear your kindest stories after 12:30. I'm Michelle Elliott. Welcome to BC Today. It's been one day since Vancouver police shot and killed a man in the latest of a series of violent incidents in downtown Vancouver. Yesterday, police responded to a 7-Eleven at the corner of Robson and Hamilton, where the alleged armed suspect had attacked two people with a knife. Both victims were injured and taken to hospital. This comes after Vancouver police announced they had identified and arrested another suspect yesterday in an unprovoked stranger assault just blocks away at a bus stop near West Georgia and Seymour Street on November 28th. Vancouver Mayor Ken Sim spoke to CBC today and responded to those incidents.
It's devastating. And there's a lot of anger, actually. It's devastating in the fact that, once again, we have people that are hurt, and our hearts and thoughts go out to the victims, their families, their friends, people in the community that have been affected by it. We can talk about how crime's down, violent assaults are down, but when these things happen, they're jarring, and they really impact, the entire community. And so from that perspective, pretty devastated and saddened. But the anger comes in the sense that we already knew that incidents like this would happen again if senior levels of government didn't step up. And the City of Vancouver, we have a lot of responsibilities, and we're making the place safer, and we can react to these things, but the root causes of these issues aren't being addressed. And so we need the provincial government to honor their commitment and give them, a high five for that. They announced that they're going to add more beds for mandatory compassionate care. We need them now. We can't wait 12 months for them. And then the federal government, I'm sorry, I'm just going to have to call them out on that. We asked for support on bail reform for repeat offenders, violent offenders, and we asked for support on the mandatory care side, supporting the provinces with funding, but also any legislative changes that they may have to do. And it's been silent. It has been crickets. It's been 79 days since we made that request, and nothing from the federal government. And that's where I get really angry. If they don't step up, we're literally, I'm going to be coming down to your studio on a regular basis, and I'm going to be saying the exact same thing. We can't solve these issues at the City of Vancouver. We do not have the jurisdiction. We do not have the tools. We don't have the funding. And even if we did have the funding, we can't do anything about it. And so we really need the federal government to step up, or just be honest to Canadians, because this is not a Vancouver issue. This is a nationwide issue.
That is Vancouver Mayor Ken Sim. You'll hear more and see more of that interview tonight on CBC News. It is now 12:10, just about 12:10 here on CBC. You're with BC Today. Well, tomorrow, CBC BC is raising funds for food banks across the province. Food banks across the country have reported record demand, and they say the system is buckling under that increased strain. We're having the broader conversation right now about food insecurity. What impact does it have on public health? What do you think is needed, and how do you yourself manage a healthy diet amid rising food costs? We're asking you on the open line. Give us a call, 1-800-825-5950, 604-669-3733, and you can hit pound 690 on your cell phone. You can also email bctoday@cbc.ca. Rita Kutsodimos is the Executive Director of the BC Healthy Living Alliance. Good afternoon, Rita. Thanks for being with us.
Oh, hi, Michelle. Thanks so much for having me and for focusing in on this very important subject.
And it's one that affects so many people. What are the implications for our health and a healthy population when we see these high food prices?
Oh, it's devastating. I mean, we've been concerned about food security for many years. It is an acute public health issue. And looking at it from a chronic disease perspective, not getting enough fruits and vegetables, and it is increasingly hard to do that with the increasing prices. It significantly increases your risk for type 2 diabetes, for heart disease, 14 types of cancer. Amongst children, it interferes with healthy development and also impacts their physical and mental health as well. So it has devastating implications.
And can you tell me a bit more about that data? Who is most susceptible to those to those consequences?
Well, when we look at food insecurity, the populations are low income. It is an acute manifestation of poverty. So what we see in the data is that it is largely the most acute numbers are in those who are in the lowest income groups. However, what we see is that working people, so people who are working full time, make up the largest number of data. So this is really a failure of our income security systems and income and wage as well. And we see it more highly prevalent in racialized communities, in Indigenous communities, and in single parent communities, pardon me, in single parent families, particularly single mothers. So it's yeah, and then in different parts of the province, that comes out differently too. So those income security issues are much more exacerbated in rural and remote communities where you see food availability challenges that are also tied into transportation challenges.
We'd love to hear from you, especially if you live in a rural part of BC or if you're someone who is affected by higher food prices. What impact does that have on public health, on your efforts at a healthy diet? How do you manage it for yourself? I would love to hear from you. 1-800-825 5950 604 669 3733, and you can hit pound 690 on your cell phone. You can also email bctoday@cbc.ca. My guest is Rita Kutsodimos, Executive Director of the BC Healthy Living Alliance. And, Rita, as we have been talking about our campaign, our fundraiser for BC food banks, we got this email from Trish who writes, I'm so frustrated with this conversation. We need to end the need for food banks. We need adequate social programs and income equality so people can afford to go to a grocery store and purchase the food they want, not simply accept the food that they're given at a food bank. Where is the dignity in that? Support a universal basic income, not food banks. Support income equality, support a living wage, support quality disability benefits. Food is not charity, it's a right. What are your thoughts on that email from Trish?
Oh, I couldn't agree with Trish anymore. All of the research on food insecurity says that the solutions need to address income. And we have long advocated for income and disability assistance rates that are based on the real cost of food, the market cost of food, and the market cost of rental rates. Because of course our housing crisis is really also contributing to this issue. There's a real gap between what is our minimum wage at 17.40 an hour compared with what is considered a living wage. And we know that that can range depending on where you live between about $25 and $28 an hour. So that's a big gap. And we also really advocate for universal healthy school food so that all of our children have access to nutritious meals so that they can learn. They've got the fuel to learn. And then some of the other issues that we hear in terms of rural and remote, we hear from our Indigenous friends and leaders that access to their lands and water and stewardship of their lands is critical so they can continue their traditional ways of their traditional food ways. So yeah, this is really I think the fact that we've got rising food insecurity is a failure of policy, and we need policy solutions. And I'm really glad, and I hope more of your listeners will do as Trish has done, and call on their decision makers to make the changes that are necessary.
I just want to highlight as well, Trish, thank you so much for raising that point in our email. And I just want to highlight as well, talking about dignity, what are your thoughts on dignity and perhaps stigma around using food banks?
Well, I hope nobody feels stigmatized, because the amazing cost pressures that everyone is experiencing now are absolutely crushing. And but people do, and we I think there's this false dichotomy where where we've gotten into this place where this emergency food charitable structure has built up. But really what we need to give people back the dignity to go and create, purchase their own food, cook their own food, make their own food. I do believe that a lot of food banks are really working towards more dignified access. There's wonderful people who provide food banks, and they are trying to do more choice-oriented delivery, but really charity is not the solution here. We need to give people their own ability to purchase their own food.
Let's take a call asking you, what are the implications of food insecurity for public health? Give us a call, 1 800 825 5950 604 669 3733. Kirsten is calling us from Saanich. Hi, Kirsten.
Hello, thank you for taking my call.
Sure thing. What do you see as the impact on health by that's made by higher food prices?
So I actually am very fortunate in that I get to see this from two instances, myself being a registered massage therapist. Unfortunately, personally, one thing I find is with the high cost of housing in British Columbia, certainly here on the South Coast and elsewhere, is with the high cost of housing, that means there's limited budgets for those who can choose to buy fresh groceries and produce. Now, again, here on the South Coast, we are incredibly fortunate to have a local breadbasket, that being of the Fraser Valley and of the Hunt Valley here on the Saanich Peninsula and elsewhere throughout the province. When it comes wintertime, however, for those that don't have freezer capacity like I do, it's very difficult to get the fresh produce necessary. The other thing is that with the limited time I have available when I'm not working to be able to cook for myself, I then often have to turn to prepackaged or pre-made foods, and those are getting more expensive as well. And I often see this as patients myself who are needing to turn away from my services simply because they can't afford them, and then they have to then turn their money into their housing and their food.
Yeah, and I really take your point there too about time, the time cost of it as well, and that must be quite stressful, Kirsten.
It is. However, I'm very, very grateful. And in fact, one of the things I would encourage everybody to do is to get together and, bounce off one another to make sure that one person stores one type of food and then another person stores another type of food, to do things communally so that way everybody stays fed.
What a great idea, Kirsten. Thank you so much. All the best to you.
Thank
Let
you.
me
Until you're the-
take care. Let me put that to you, Rita. Really interesting point there about produce, and we know that because of importing from California, a lot of it is imported from California. The prices are going up because of the cost of that transport. Are vegetables, fresh produce, are they kind of the first things to go?
Yeah, well, it's sad because that should really be the last thing to
Yeah,
go.
yeah. Crossing it off the list is like that's what should be on the list. Yeah.
Yeah, we really need to prioritize fruits and vegetables above all else, especially if we are looking at protecting our health. But your caller makes a really good point in terms of working communally and using your freezer, of course. With the housing crisis, and we know so many people are underhoused, it's really tragic because a lot of people don't actually have great freezer capacity or all of the kind of kitchen amenities that we need. So definitely partner up with your neighbors where you can use your freezer, buy on the sales, but also, again, contact your local MLA and let them know that you want some policy solutions because with climate change and the cost of fuel going up, this is not going to get better. And it really is a tragedy that we have so many people in our province that are not able just to get the basic nutritional requirements to be healthy.
Well, we're hearing now from a senior through email. Joan writes, as a local income senior, the OAS, the old age security, does not cover all expenses. And because I am a few dollars over the limit to get the supplement, it's not easy to buy healthy groceries. And I don't want to buy processed food. I think the provincial or federal government should give each adult that makes less than 40,000 an extra $2,000 a year direct as a food rebate. That is $40 a week. I don't see why the general public should have to support food banks or even have food banks. Our pensions need to be higher. And when they give rebates, they shouldn't be for folks who make more than $90,000, which seems like a lottery win to me. Thank you for your email. Of course, the federal government has been talking about this rebate coming in the spring. There's some discussion and debate around that as to who it covers, because it covers working Canadians and who it leaves out. Let's take another call from Sue in Oliver now in the Okanagan. Hi, Sue.
Hi, how are you today?
I am fine. Good to hear from you. What are your thoughts on food insecurity and health?
Well, I live, like as it was mentioned, I live in Oliver, which is between Oliver and Osoyoos, a huge tourist destination. So in the summertime, our food costs almost double because of the influx of people coming in, and that doesn't help us locals, because after it doubles, they bring the dollar value back down, but not to where it was before they doubled it. So we are definitely feeling an absolute huge impact on these food costs.
Even though you're, someone mentioned the bread basket, you're in a place that is, bursting with produce in the summer.
Exactly.
Yeah.
Yeah. Although more wine now, because everybody seems to be ripping out their orchards to put in wine and stuff like that. Well, wine isn't going to feed you.
Yeah.
So it's very sad that our government has not stepped in to cap these food cost rises.
Sue, thank you very much. Good to hear from you and Oliver. Rita, what policies do you think are needed?
Well, I think there's a range of policies that are needed, and as I mentioned before, I think primarily we need income supports. The caller before talking about old age security and the guaranteed income supplement, those need to go up with the cost of living, and I think that's really important that they do so that people aren't falling between the cracks. And I will just note that, previously we looked at, we had very low levels of senior poverty, and it was because of the old age security and the guaranteed income supplement. So that is actually a system that has proven to work in the past, and I think we need to strengthen what we have now in order to benefit from that. On the on the food cost, and looking at, we do have our agricultural land reserve. We need to protect that. There's quite a few people who say that we need to invest in young farmers and really help the next generation of farmers get going. We've got an aging farming population, and we've got, a lot of our farmers are actually experience poverty themselves. So some people have suggested that we need some sort of a basic income for farmers, for the people that are growing our food. Um, but um, but yeah, we absolutely have to protect the precious land that we have for the cultivation of foods.
Doreen is our final caller on this topic of food insecurity and health. And Doreen is joining us from Victoria. Hi, Doreen.
Hi, thanks for having me.
Sure.
My name is Doreen G, and I'm very politically active here in Victoria, and I've done a lot of writing about this. I'm also a 73-year-old senior, and I'm trying to survive on the old age pension right now, and it's very, very difficult. And I want to echo, and I agree with the previous caller's comments. When OAS first came out I think back in the 60s or whatever, 70s, it did actually raise a lot of seniors out of poverty, and that was wonderful. But I think around 2007 or something, it started to go the other way, whereas old age security pensions became less and less, much less than what people were getting, and a lot less than, even lower than the poverty line.
Yeah.
And now it's so bad here in BC that I think it's half of all BC seniors get less than the living wage of people in BC. So half of us are living way below, and they need to raise the OAS rates. And also,
Okay.
I'm particularly outraged at the federal government for when they
Okay.
put in this two-tiered system where only
Doreen,
people over 75
I'm gonna jump in. I'm so sorry, just for time here. But Doreen was talking about the two-tiered system when it comes to those senior supports. Thank you so much for your call, and Rita, thank you for your time on this important subject.
Oh, thank you, Michelle. And good luck tomorrow with the food bank day. I hope you get lots of donations for
You take care.
fresh produce.
That's Rita Kutsodimos, Executive Director of the BC Healthy Living Alliance. 12:28 now. And yes, ahead of tomorrow's Make the Season Kind fundraiser, it is, of course, tied and coincides with Taylor Swift's concert and the opening of Eras in Vancouver, the Eras Tour. We here on the show have been asking for your first concert memories. And Victoria wrote us from Nanaimo. My first concert was at the Fox Theater in downtown Detroit, 1965. Stevie Wonder was a little child, just around 15 years old. We're the same age. Stevie was up there playing his drums and singing Fingertips, his first hit. This was the Motown Revue in Detroit. Unforgettable. And Deb wrote, my first concert was in 1973 at Maple Leaf Gardens in Toronto. This was to see Alice Cooper, and the opening act was ZZ Top. I was too young to realize how lucky I was to get two great shows for the price of one. Brian is another Alice Cooper fan. Yes, 1973. Was it the same concert? Same tour, it sounds like. Alice Cooper with Flo and Eddie. Okay, not the same concert. Big Rock Show at the Coliseum. Before that, Jeunesse Musicale at the Queen E around 1967, giving culture to us urchins. And another one, Roy Orbison in Glasgow. I was 15. My sister and I rushed the stage and had to be pulled back. Thank you for all of your emails. And yes, tomorrow we will be on a stage ourselves outside on the outdoor plaza for 3 hours from 12 to 3, myself and Margaret Gallagher for our Make the Season Kind program, special guests, live music, all to fundraise for food banks around BC. So do join us if you are going to be in downtown. And in honor of Make the Season Kind here on BC Today, we are going to take your calls and your stories of kindness. When have you experienced it? When has someone been kind to you? I know those moments, they stay with us and they stick around, and you have that that memory of someone, perhaps a stranger or someone you know, who was especially kind to you in a certain moment. And we'd love to hear that story. That's coming up after the CBC News Update with Rob Zimmerman.
Good afternoon. There is no tsunami threat to BC after a large earthquake off the coast of Northern California. The 7.3 magnitude quake hit near Eureka just before 10:45 this morning. The Pacific Tsunami Warning Center issued an alert for a stretch of the west coast from Oregon to just south of San Francisco. There was no alert issued for BC or Washington state coasts, and officials say the tsunami risk has now passed. BC is launching a review into the province's 911 emergency communication service after complaints about costs and transparency. Public Safety Minister Gary Begg says the review at ECOM, which maintains the system, will cover financial records to ensure operational sustainability and efficiency. And there are more calls for involuntary care today after yesterday's stabbing at a Vancouver 7-Eleven that left 2 people injured and the suspect dead. The man was shot and killed by police. Vancouver Mayor Ken Sim says the city doesn't have the money or resources to properly deal with street disorder and violence. And now the forecast on the north coast. A chance of showers this afternoon with strong winds and a high of 10, highs to 6 and mainly cloudy in the Peace. In the central interior, including Prince George, mainly cloudy with a high of 5. Highs from -3 to +2 with clouds in the Kootenays. In the southern interior, including Kelowna, mainly cloudy with a high of +1. And for Metro Vancouver, Greater Victoria, and the Fraser Valley, cloudy this afternoon with some fog patches and highs around 8. That's your CBC News Update from Vancouver.
So, you know the Gastown steam clock?
Yes, I do.
Think of how it usually sounds.
Okay.
Just whistle in your ear. But today, a half an hour ago at noon, it sounded very different. Of course, in honor of the Taylor Swift Eras Tour. What is it about Taylor? What is not about Taylor Swift right
question,
now?
Yes. Good question.
Exactly. So Vancouver's historic Gastown steam clock is getting in on the action as well. The chime that you usually hear was replaced with Shake It Off at noon today. Here's what it sounded like. I don't know, but I couldn't make out Shake It Off in there.
I don't know Shake It Off, but that was interesting. Let's just say that. How long is that going to be going for?
I think it's done.
Oh,
So
it was
you
just
can-
it was a
you're safe
one-off.
now.
It was a one-off.
Yeah, it was a one-off.
I see.
Just for noon. That was what was advertised. But I have to say, the shot, if you were watching on our live stream, it was gorgeous. Just that very moody gas
Some
down
fog and
shot, some
stuff?
fog. And it's a foggy day, and then the steam coming out. Must have been a moment. If you're a Swiftie, I hope you
Sure.
enjoyed it.
Yeah, nice, great.
Rob is not, but that's okay.
Yeah.
We still love you.
Thank you.
Thanks, Rob. Rob Zimmerman in the CBC Vancouver newsroom. It is the eve of Make the Season Kind here at CBC, and that is tomorrow's annual special day of programming in aid of food banks around the province. There are 110 food banks in BC right now, all in need of support with record high demand. I'll tell you how you can donate if you like in a moment, but first, here is a longtime food bank volunteer.
My name is Leticia Sanchez. I am a volunteer at the Vancouver Food Bank. I started volunteering here in 2019 when I had my cancer treatment and I was unable to work. So for me, staying active in the community and supporting different organizations, not for profit especially, is too dear to me, especially the food bank. I am in the distribution section, and I am working directly with clients on one-on-one basis, and I think that that is the most rewarding way of making them feel safe, secure, with respect. When they come to the food bank, some of them are scared, some of them feel a little bit uneasy of coming to the food bank and asking for support. But in these challenging times when it's so hard, the cost of living is so high, and even families who in the past didn't need the food bank, now they're needed. And so to me, being in the distribution area is a way to connect with them and make them feel cared and respected. The food bank supports one meal at a time and one act of kindness at a time. I think that sounds like a cliche, but definitely being kind to others helps you get back in return, get that kindness in return, which is something that the society needs so much. We are divided sometimes, and divided by wars or divided by society or class, but being kind and helps us be a stronger society and a stronger community.
Thank you to Letitia for sharing what it's like to volunteer and for volunteering at a food bank. Tomorrow, Friday, December the 6th, we do have a full day of special programming. Our annual CBC British Columbia Make the Season Kind fundraiser in support of food banks, the 38th year now. And it started in the 1980s. You are all indeed kind and generous when you donate. You can just go online to donate. That's cbc.ca/kindbc. And I'll be on the air for 3 hours tomorrow with some special guests and live music as well. And I'll be co-hosting with Margaret Gallagher. And in honor of Make the Season Kind, we would love to hear from you about how you have experienced kindness yourself. When has someone been kind to you? You can call us 1-800-825-5950, 604-669-3733, or you can hit pound 690 on your cell phone. Our email is open as well. You can email bctoday@cbc.ca. Now, when it comes to kindness, we do have one story to share right now. It's a story of a young soccer team in Pemberton and what they're doing to help their community. Joining us now is Christine Cowan, who's a community engagement coordinator with the Pemberton Youth Soccer Association, and Graham Murphy is a coach. Hello to both of you.
Hi, Michelle. Hello. Thanks for having us.
Thank you so much for joining us. Coach Graham, can you tell me about the Rapids?
The Rapids is a team, a community team that's coached by Coach Mike Haynes, and the other coach is Chris. And I'm the actual, I offer technical support to the team, so I don't actually coach that team. I technically support the whole club. So, but yeah, they're an awesome group of young boys that I've worked with this summer, and yeah, just great community members, like great energy, great teamwork.
Wow.
And, yeah,
how old are they?
These children, I believe, are 10 to 12.
10 to 12.
To 12.
And
Yeah.
Christine, tell me about what they decided to do for the community.
Thank you. Yeah, so this initiative began with a kind of a simple act of kindness. The U11 boys soccer team, the Rapids, challenged themselves to donate $1 to the food bank here in Pemberton for every goal that they scored this fall season. The other players and their families not only embraced the idea, but amplified it. They matched the donations and inspired other players on the team and other families to give. The donation quickly grew from about $30 up to $1,000.
Oh.
And then when other local businesses, it's a small town here in Pemberton, and other local businesses heard about the initiatives and they kicked in as well, especially Coach Murphy, bringing the donations to a total of $2,700.
Oh. So was everybody cheering for each goal, not just because they got a goal, but because they knew that was going to mean at least another dollar toward the food bank?
Yes, and our fields are all next to each other. So on a Saturday morning at soccer, you had kids from U5 all the way up to U14 all cheering on the Rapids because they knew what that meant for our community. So it's just astounding, and it really showed the kids how a simple act of kindness can ripple outwards, bringing together local businesses and our community to raise that money. It's a really powerful reminder of how small gestures of kindness can grow into something so much bigger.
Wow. And Coach Murphy, this inspired you as well, right?
Yeah, I would say it really inspired me from a community standpoint rather than the sporting standpoint. Just,
Right.
that was actually a funny story because I was getting my hair cut by the coach who's a local barber, and my business is across the street. So I'm a volunteer technical person working with the soccer club. And he told me about the initiative, and I went back to my office and told my team about it, and, working with the children as well, the athletes. So I was like, well, this is amazing. And we generally do something for the local community initiatives anyway every year around Christmas time, and it just seemed like a great opportunity to showcase what the children had done. But also, I would say what was really impressive for me was I said I want to find out more about why they did what they did. I don't just want to hear about the sporting and the cheering. So it was actually really interesting. They all marched down to my office one day after school with their dogs and their parents, and came bursting into the office and did a presentation to me about why they were doing it and who they were doing it for, and it was really meaningful. And some of my staff members were almost moved to tears over the presentation they gave.
Oh, wow. Was there something they said that stuck out for you?
Well, I wanted to know why. I think it's really important when young people do these things that they understand the meaning behind it, and it really resonates with us as adults to hear that. So when I asked them the why, the one thing that they said was, sometimes some people are just not as fortunate as the rest of us, and everybody needs food.
Everybody needs food. I mean, it's so simple, but it's not it's so simple. It seems that it would be simple to address, but unfortunately, the
Well,
reality is they can't.
The other thing, Michelle, that they said as well is we all might be less fortunate sometimes. Some people just need a little bit of help sometimes, and not really, we all go through waves, right?
It's funny, Christine, when you said the fields are all next to each other. For a moment, I thought you said the fields. Our fields were because I figured
They were there too.
Yes, I'm sure. I mean, Coach Murphy just said a staff member was near tears. What impact has this had on the community, and how has the food bank in Pemberton responded?
The soccer team actually presented a check to the food bank this week. It's a small food bank here in Pemberton, but it's no small impact that they make. So I was really grateful to accompany the boys and kind of see the look on the food bank director's face. And she was really, really proud of the community. I mean, she knows a lot of these boys just from being around town and being at the school. And so I just think it really inspires connection in our community. I think community is one of our core values at the club, and I just think it makes the kids feel really connected to the community and to the club, and it's really quite remarkable.
Well, what kind of example would you like to use, or what? How would you like to use as an example for the rest of us? What message do you think we can glean from the story of the Rapids?
That's a good question. I think this initiative is proof that small acts of kindness can grow into something extraordinary. And I just hope that this story inspires others to find their own ways to make a difference in their community and really find that connection, especially at this time of year.
And what about for you, Coach Murphy?
I think this generally, this can create some stimulus. Like when we left the bank, because when I walked over to the food bank with the players on the way back, they were already talking about what they could do next year, how they can grow it, involved. And I think it's just, like Christine says, small things build big things, but if we don't do them, we'll never find out, right? So just do the simple things well, make a difference.
So great to hear from you both. Thank you for sharing this lovely story, and do send our regards and congratulations to these young soccer players who are making a difference in your community.
Thank you so much, Michelle. Appreciate it.
Yeah, thanks for having us. Happy Christmas.
And a happy Christmas to you. That is Graham Murphy, who is a coach with the Pemberton Youth Soccer Association, and Christine Cowan, who is the manager of community engagement there. So with that one example, we'd love to hear your examples of kindness. Let us know when you have experienced kindness yourself. 1-800-825-5950, 604-669-3733. Douglas is on the line in Vancouver, and I understand you have a wonderful story to share, Douglas.
Michelle, my story should follow up on the people from Pemberton in the lady who said about small acts of kindness. Several months ago, I was diagnosed with a growth on my cerebrum, a mass of cancerous growth, and consequently, I went to the Alberta or Vancouver General Hospital for an emergency operation of about 4 hours, where they drilled a hole in my skull and removed this growth. I was in the hospital for close to 2 weeks, I guess, and my acts of kindness were to 3 ladies from my church community that came daily and visited me. And we talk about small acts of kindness, and it was so much appreciated. And I think we often don't realize the impact that small acts of, such as visiting or something, other people bring about a lot of help and assistance. And so I just wanted to share that with you.
That is so lovely. I hope that they're listening.
I hope they are too.
Yeah.
Thank you very much.
Douglas, thank you. And how are you doing? Oh, I think that he's hung up. I understand he's doing well, and I do hope that the 3 women who visited him daily in the hospital are listening. Happy holidays to you, Douglas. Linda is on the line now from Campbell River with a story about receiving kindness. Hi, Linda.
Hello there. Thank you for taking the call.
Oh, I'm so glad to hear from you. What's your story or your experience of kindness?
My story is about my own daughter. When she was just little, I have a finger sewing machine that I always still sew on, and she was so into it, and I said, well, when you're tall enough and your feet can reach the pedals, I'll teach you how to sew. So she was tall enough at 5 years old, and she's still grown. But anyhow, so I came home from work, and after I taught her to sew and everything, and on my sewing machine was a pile, at least a dozen purses she'd made, like with a drawstring. And I said, these are lovely. What are we going to do with these? And she said, these are poor people purses, and we're going to fill them with money and give them to poor people.
You're going to fill them with money and give them to poor people. Wow. How old was she when she did this?
5.
She was 5. Oh my goodness.
She's still the same person. Her name is Sophie Gardner, and she is still very absolutely kind and generous, and as well as her boys.
Wow. What a lovely gesture for her to be thinking about others at such a young age.
Yeah, we filled them with treats and money and just put them on anonymous doorknobs that people that she knew that she thought should have them.
What was that experience like for you to go through that with her?
Oh, it warms my heart, and I kept one of them for myself. She made one for me, too, so I kept it. I still have it. And I think, God, time flies. Time flies, and so it's so important to be kind while you can. If you even think about it, just do it.
Sophie Gardner, a kind person from a very young age. Linda, thank you very much.
You're very welcome.
Love this story. That's Linda in Campbell River. And we're asking for your stories of kindness. And when has someone been kind to you? You can give us a call, 1-800-825-5950, 604-669-3733. You can also email us at bctoday@cbc.ca. Betty wrote us an email. I have to use a motorized chair, and one day my husband and I were heading to leave a store. A young man all dressed in black with chains hanging over his shoulder and a black cap trimmed in chains went ahead of us through the door and allowed the door to slam in our faces. My husband went to move around me to open the door. When the door was yanked open by this young man, he said he was sorry and held the door for us. We had a lot of thanks to give to him. Thank you. What a turnaround in that story, Betty. Thank you very much. Again, 1-800-825-5950 and 604-669-3733. Call us and share your stories of kindness. When have you seen it around you? When have you experienced it yourself. I know that, I'm a parent, and I know that I always appreciate when I hear kindness from for a kind word from someone just saying, you're doing great. Parents always have to hear that. You're doing great. Again, 604-669-3733, 1-800-825-5950. Romy is up next now in Nelson. Hi, Romy.
Hi, Michelle. Good afternoon. Thanks for taking my call.
Thank you very much for calling, and do share your story.
Well, my kindness story involves my former neighbor, April. And April provided me with fresh produce and other things during a difficult time. And she did that from the food bank where she volunteers. April also took my dog for walks when I was with COVID, and I was extremely sick for almost 2 weeks. So I will never forget April's kindness.
And I'm sure that came at a time when you really needed it.
Absolutely.
Yeah. And have you had a chance to kind of have a conversation with April about that and just sort of thank her and in a meaningful way, Romy?
I have.
Yeah.
I have.
It sounds like it was an emotional conversation.
Yeah.
Yeah.
Oh.
Romy, really good to hear from you. Thank you very much. That's an important way to help out as well. So thank you for sharing that.
You're welcome. Thank you.
Take care. That's Romy joining us from Nelson. Again, 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone. And you can also email bctoday@cbc.ca. And we have a call coming. I'll just give the number out again, 1-800-825-5950. Deborah is on the line now from Nanaimo. Hi, Deborah.
Hello there.
Hi, thanks very much for calling. And what's your experience of kindness?
Well, I had an experience of being in the hospital about 3 years ago, and somehow my hair never got combed when I was in there, and I came out with this huge tat that I couldn't comb through. I couldn't put conditioner in or control it in any way. So I have a friend that came over and spent an hour and a half taking out the tat.
So your hair was all tangled, is that right?
Yes.
Yeah. Okay. And she spent an hour and a half.
And then she washed my hair, conditioned it, trimmed it, and cut it into a nice style, and then blow dried it for me. And I felt like a brand new person. Oh. And I'll never forget that act of kindness because it took her a long time, and she was so patient and kind.
Oh, wow. And I'm sure, there's something about feeling like you're being taken care of in that way, right?
Yes. It was terrific because I had worried about this tangle in my hair the whole time I was in the hospital. Oh. How am I going to do this when I get home? And she used to do horse manes and comb them.
Yeah.
She had lots of experience with combing, and so it came in handy and it helped me out.
She knew what she was doing.
Yes.
Oh, that is, that's an unexpected story, but what a way to help a friend who's been in hospital. Just thinking about how we're going to help her with her hair. I love it. Pardon?
Hair is very important.
Hair is very important. And as you said, you felt like a new person afterwards, right? Don't overlook it. Deborah, thank you so much for sharing that lovely story.
Thank you for having me on.
That's Deborah in Nanaimo. And let's stay in Nanaimo. Keisha is joining us now. Hi, Keisha.
Hi there.
Hi, what's your story of kindness?
So my story of kindness is I was immediately postpartum with my son. He was about 8 weeks old, and I was struggling to get my groceries from the cart into my car. And a group of 3 young men saw that I was struggling and came over and offered to help. And I was so surprised and so appreciative of the offer. It made my day and made my struggle a little less. It was great.
Oh my goodness. I know that feeling of struggling with the groceries while you're with a son in the stroller, I imagine, right, Keisha?
Yes, yeah,
Oh.
he was quite young and unhappy, and to have they were young men, like probably high school, and to have that kindness recognized from people in a very different age bracket was very, very kind. Yeah.
Oh, I can hear you getting a little bit emotional about it too. Yeah. And how old is your son now?
He just had his first birthday.
Oh, wonderful. What a great story that you'll be able to share with him. And an example for him growing up too, right?
Absolutely.
Oh, Keisha, great to hear from you. Thank you.
Thank you.
Helping out with the groceries. I know that feeling of struggling to get everything into the car as you've got a baby waiting as well. Joan wrote us an email about kindness. Thank you to the caller who was recovering from brain surgery. A beautiful awareness of how even short but frequent visits to those in need, in hospital, and in care has an impact. I can't do over the past, but I can learn how I can act in the future. That's a sentiment that we can take from these stories, what we can do moving forward in terms of spreading kindness. Gayla writes as well, a family member had the recent experience of utilizing our medical system. He found the urgent care staff at the Royal Jubilee Hospital, including paramedics, nurses, technicians, and the doctor, to be very kind and caring and reassuring. Yeah, kindness among healthcare workers, that always makes such a difference when you're going through that. And I know it's during those moments when you are struggling and not perhaps in the best place physically, that those moments of kindness can really help. And our number again is 1-800-825-5950. I do have just a minute here, but I'm going to go to Maureen in Penticton. Hi, Maureen.
Hi, how are you?
I am well. What's your story of kindness?
My granddaughter was visiting me from Vancouver. She was 13 at the time. She saw a lady in the parking lot trying to get her husband out of his wheelchair.
Yeah.
And she said to me, "I'll be right back." She went over. The man was blind, and he had dementia.
And she helped him.
And she helped the lady get the man in the car seat, buckled him up.
Kudos.
And then helped him with the wheelchair.
Oh, Maureen, kudos to your granddaughter, 13 years old. So kind. Thank you for the call.